Good evening, everyone. Let's begin this webinar because it is a Friday night. Let me first introduce myself. My name is Kim Lee. I'm the Business Development Director at Medical Protection Society, which also includes dental protection as well. Tonight, we do have a great lineup for speakers to share with you some of their thoughts and their knowledge. Without further ado, allow me to introduce Tang Chun. Tang Chun is the student representative that has been assisting us with this evening's presentation. Over to you, Tang Chun.
Hi, everyone. Hi, I'm Ting Chun. I'm the president of the Dental Club, which is the student body representing dental students in the Faculty of Dentistry of NUS. Yeah, so today we have how to avoid dental legal pitfalls. So I think personally, I feel that this is quite a pertinent issue and something that we should all consider, because even though right now we are still learning the more basic things in the trade, but subsequently when we go out and practice, this will be things that are important and will pertain to us in the future. So I hope that everyone enjoys this webinar, and yeah, if you have any questions later, I'm sure you can post them to Mr. Foster, later our speaker, and he'll be happy to address them. Thank you.
Okay, right. Well, good evening. I shall just share my screen if I may. Thank you. Well, good evening, everyone. I hope you can hear me okay. My name is James Foster. I am a dentist and qualified in the UK and worked in the UK in general practice for a number of years. I then taught at the dental school in Newcastle and was involved in training of foundation training, which is a scheme in the first year of qualification in the UK, where people are effectively given their license to work in the government and the NHS system. And during that time, I was associated with dental protection and then did a medical law degree to become fully involved and now work full time and have responsibility across Asia and Australasia. And it's a privilege to work in this role, supporting and trying to assist colleagues when they get into trouble, but also trying to help them avoid finding any difficulties in the first place. And that's really where we want to focus on this talk this evening. So one of the important things for me to emphasize is that, of course, whilst I talk about things that go wrong and problems that can arise and issues that occur, the vast majority of us enjoy success and enjoy practice. It's a wonderful profession, and you're all incredible achievers to get to where you've got to. And the last thing I want to do this evening is to make people worry about the risks that they may face. Could they be sued? Could they get a dental council complaint? Will patients complain about them? Because these are rare. Now, there are ways to minimize them and make them even more rare, but there's also ways you can also address problems when they've arisen to reduce the risk of them developing further. So there's a few little areas we can focus upon, and please don't be overly worried about the risks to a practitioner. Chances of complaint are low. They do happen though, unfortunately they do happen, and we need to know about them and how to avoid them and what to do when they do. Okay, so let's have a little look then if we focus on what can go wrong. Well, first of all, when we think about what can go wrong, we're going to mostly think about a clinical error, a human error. Now, we are all human, and of course we make mistakes, and that is always going to happen. You're never going to eliminate completely human error. So we need perhaps just to recognize that and not beat ourselves up too much when things perhaps do go wrong. We can obviously take steps to minimize the risk, to check our training, etc., retrain on stuff, but I'm afraid human errors will always occur. The training and competence, well, have we embarked upon a course of treatment that perhaps we weren't correctly trained for or competent in? Having said that, we've got to obviously progress our development and move forward in what we do. Otherwise, we stagnate and don't develop. but we do so under the correct circumstances. For example, if you're starting to do implants, you do the correct courses, work with a mentor, overseen, etc., and develop to a skill where you can then go solo. So it's about just recognizing the need for training and competence. And unfortunately, we see a lot of cases arise where that's not been adhered to. Poor case selection or assessment, a poor pre-assessment. I'm afraid sometimes we do see situations where people have dived straight into something, and before they know it, they're deep in trouble. And a really comprehensive approach to case selection is important, particularly, for example, if the patient is someone with incredibly high expectations. If somebody has expectations that aren't met, then there's always going to be a conflict. So it's very important to make those, have those open conversations first. And in terms of consent, we have a lot of claims that arise based in consent, where basically if there's an outcome that's not ideal, and the patient may say, well, I didn't know this could have happened, and therefore I'm going to challenge you. So consent is vital, and there is a whole raft of material on consent available, and it is important. Obviously, you've got the civil law amendment, which is topical at the moment in Singapore, and it is important that you consider what that specific patient needs to know about the treatment they're about to have. We do see matters arising from colleagues' comments. A colleague may see a patient and make an unfortunate comment about your treatment, or you may actually say something about somebody else's treatment, and it may be misconstrued, or it may be used upon a patient who's got disaffected with their previous practitioner or yourself. Reaction to challenge. We're in the healthcare profession. If we have a patient who is aggressive and rude, we're in an environment we're not used to. And sometimes if we fight fire with fire and adrenaline kicks in and the fight or flight system, and we start shouting back, or explore our progression once we've graduated. And I understand some of you at year 2, year 3, and some final year. When you do graduate, focus is really on building your own reputation and making your practice successful. Now, in terms of building your reputation, it's all about communication and ensuring that you are competent to do the work you're about to do. In other words, you aren't pushing the envelope too far. And in the early years, those are the areas that we tend to see the problems arising, when people are jumping into work that is perhaps something they're not quite competent in as yet. As I said before, you've got to develop, but you do so in the right environment, and don't jump into the stuff beyond one's own competency at the time. And communicating with patients is huge, and I'll come on to that. And then when you're up and running, as I mentioned before, human error, things will happen, adverse outcomes will occur. How do we handle those, and how do we handle professional challenges? Now, in terms of building your reputation, if we look first of all at a very significant principle I'd like you all to really consider tonight, it is the main principle, I believe, of importance. In the early years, and I'll use myself as an example, I graduated from Newcastle Dental School in North of England, having not finished a molar endodontic treatment. I'd done a few canals, but I hadn't finished a complete molar endodontic treatment of a tooth. And then you see I'm in practice and I'm having to do molar endodontics. Now, am I likely to come across some problems when it's a procedure I've not completed before graduation? Well, yes, I am. So I'm probably in those early years more likely to come across a difficulty and a problem in my clinical technique. Okay. Now, in that period, I need to work on my communication to ensure I've got a good relationship with the patients. And this is why, if we look at patients who complain and patients who take things further, there's two areas in which we need to concentrate and consider. Now, if we think of a patient who's complaining, we're likely to align that to some sort of precipitating factor. We're about, right, something's happened. You know, what's going to happen to make a patient complain? Okay, well, an adverse outcome, an injury, you cut the floor of the mouth, you cut the lip, failure to provide adequate care, you don't provide, you know, I didn't, molar endodontics didn't go so well. You make mistakes, systems errors, appointments are double booked, etc. Those are things that we all think that's going to trigger a complaint. But a lot of the research talks about, okay, well, that's a precipitating factor, but it all depends about the predisposition of the patient as to whether they actually do take a complaint further forward. Okay, so if we think, all right, those top list, that's the things that most of us would think, well, patient's going to complain after that. All the research points towards those that do proceed with a complaint have generally had experience of the lower, a predisposing influence, in that they have found perhaps the practice, or find you at the time, if there is a perception that perhaps people are rude to them, they delayed, inattentive, miscommunicative, and apathy. So in other words, if I'm a patient making a complaint and my perception of the dentist or the clinic is that they don't really care, then I'm going to go to someone who'll listen. So if I'm predisposed and then one of the above occurs, and bear in mind we're human, the above will occur, then I'm going to take it further. So in the early years, when we're perhaps not got that much clinical experience, where things may occur on the top, if we focus on avoiding predisposing, focus on our communication skills, focusing on building a rapport with our patients, then we give ourselves the protection jacket that when things go wrong, patients will be far less likely to pursue us. And there's a lot of work around this. So please remember this principle. Build a relationship with your patient. And quite simply, if they like you, trust you, think you care, they are far less likely to have a go at you if and when things might not come out as intended. Now, in terms of protecting it, adverse outcomes will occur. How do we react? How do we handle a situation? I'm just going to run past one example that we see, and it does occur because our patients lie supine, and that's unfortunately sometimes things get ingested. And if we just use this as an example to describe how we can influence the actual outcome in the long run. So here we have a patient who unfortunately has inhaled part of a dental kit, dentator screw, and we've got one scenario versus another. Now, in one scenario, which unfortunately we see a lot of, the patient is sat up, they're told, well, look, I think you've swallowed or inhaled something. You best go to hospital and have an x-ray. I'll finish your treatment, patient pays for the treatment, and then they're told to go and get medical care. Compare that journey and how the patient might feel with an example where the second scenario, where the patient is informed, there's an outright apology, which is not an issue. It's very advisable. There's an apology to the patient. This has happened. The patient is then taken by a member of the team to a hospital that you yourself maybe have telephoned to tell them what is happening and who is coming to them. You give the patient something very much similar to what they may have ingested to give the medics an idea of what we're looking at, you know, what it could be there. Then they're sent off to hospital. You give people like us a ring and we say, right, just tell the patient you'll cover the medical fees, do that with pre-approval. Then you call the patient that evening. You see how they're doing. You call them the next day. You ask them to come back for a meeting to discuss if they wish, or their family, and you look after them and you stay on the journey with them. Now, which of those patients is going to be likely to take that further? The first by a mile, okay? So it's all about looking after the situation and reacting and working appropriately when you come across something. And managing adverse outcomes is key. And there are, we do have lectures and specifically expanding on that, but those two issues are really, really important. Your communication with the patient to build rapport, and when things, if they do go wrong, you look after the patient and you look after the situation. Now, how do we develop ourselves in terms of knowing and understanding risk and becoming risk aware to be successful and protect our reputation? So individual and experience and reflection, reflective practice, you know, why did that instrument get dropped? Why did capture that we get from patients, generally we will, but it's a good source, because if the patient's experience is negative, then you can take that on board and know what to do next time. If I had a patient coming in from another practice, say, I'm not going back there again, I would say, well, what happened that you've come here? I would hate to make the same, do the same thing to you that you didn't like. So it could have been that they were double booked, missed an appointment, or it could have been the manner, or it could have been even the music was in the surgery. There's all sorts of things. So establish what's going on. From colleagues, you see colleagues, using senior colleagues as mentors, trainers. Find a good practice with a senior dentist who's happy to be your mentor is an ideal situation. Be careful of situations where the reverse happens. We learn from legal cases. They're part of the public domain. When you see situations arising, in Singapore, there've been some recent ones about fines at the medical council and what's the impact on the dental council. So you still keep abreast with what's happening in your profession when you graduate. Regulatory investigations, the dental council publish their cases, and it's worth making sure you're aware of what's going on, what's happening in the country, what sort of things are being investigated, and what are the relevant determinations and sentencing. You need to know the rules of your game, and obviously you don't want to be following any falling short of any of the ethical codes, but you need to realize what's happening in your area of work. Having a look at dental protection cases, look on our website. We've got lots of case studies, etc., which can help, and doing and seeing also research, keeping abreast of publications. Now, people say, to me as a dentist, what sort of stuff do you see? What do you see coming across your desk? So just really to outline the areas where we see cases coming in to us. Dental legal issues can arise from a huge variety of areas, but we tend to break them down into 7 case types. So advisory, a dentist may need advice on dental legal matters such as retention of records, or they want guidance in managing a difficult situation, or indeed a difficult patient or a difficult relative of the patient. Reports, for example, a patient might have an accident out in the public and ask for dental records to demonstrate injury, such as a car accident, and our members often asked for an opinion, and we'll be advising, just be careful what you put in your report, because if you are to write a medical report suggesting the long-term impact of an injury or how much it's going to cost to repair, etc., you might be dragged into the situation saying you've acted as an expert witness. So if you get reports that others are going to use, patients are going to use for making claims of their own insurance, make sure it's very factual and don't give an opinion. And also, patients who are unhappy might more commonly ask for a report, and colleagues will ask us for an opinion on what they can divulge. And again, you do it as a factual report based on your records. And I'm sure record keeping is playing a big part in the undergraduate teaching, and I'd certainly say record keeping is hugely important should you ever be challenged, both in terms of the Dental Council as our regulator and in terms of potential claims arising, because the old adage, if it's not written down, it didn't happen, is not quite 100% true, but it's pretty much there. Complaints, see routine clinical complaints such as dissatisfaction with full dentures through to a nerve injury, and some complaints may also include practice management issues. You often see elements brought in, and it's important to establish the core of a complaint, not the peripheral wrappings around a complaint. And I'm talking things like, and another thing, you didn't see my mother, and another thing, you were late to the appointment. Those sorts of things we don't focus on. You need to establish the core if you ever in a situation to get a complaint. We also see reimbursements. If someone's had treatment that's failed and there's a vulnerability there that it's not quite appropriate, or consent's not been done well, the treatment itself, then it may be that we facilitate care to be carried out by a third party, and that will help resolve the situation from going any further. Regulatory cases, that's dental council cases, we advise on the approach to take, draft submissions with local panel lawyers, and suggest remediation as mitigation of sentencing, where perhaps if an area is, the complaint is in terms of an issue with root canal treatment, it might be that you help yourself by doing a lot of root canal training before the hearing arose, and that might mitigate the sentence. And we'll also assist panel with assistance from panel comes with representation at any hearings that may take place. Claims, complaints may develop into claims, and dental counsel investigations which have had an adverse finding may also develop into a claim as the patient seeks financial compensation. And we use legal teams in country with panel and also within MPS with clinical input from individuals such as myself, and we may also involve expert witnesses as we do with dental counsel cases. Now, in terms of what cases people have, it's a variety, and they can interact. You can have both a complaint that is a claim and it goes on to a dental counsel. So there's grey areas where it involves all of them. And when we say to colleagues generally, you know, are you concerned about being subject of a dental counsel complaint or a claim? A lot of people think, oh, being sued is the worst thing. I don't want to be sued. Well, actually, being sued is a financial exchange, essentially, whereby the patient or the family is after financial recompense. And that's what indemnity is for, because that's taken care of. It all comes out of the indemnity. If it's a dental counsel complaint, the dental counsel can unfortunately remove your professional life, stop you practicing. So the dental counsel has far more significant impact, and that's why, you know, it is important, and I'll emphasize it again, you need to understand the ethical code and follow the rules both in and out of the surgery. Now, common issues that might arise, and we're just going to go through some case studies to give you some idea of how best to avoid heading for difficulty. This is a situation you sometimes see where the senior dentist in the practice has extracted a tooth. The notes say complete extraction, root in its entirety. Patient comes back in pain, and perhaps the younger colleague sees the patient and sees the notes, sees that the tooth in the notes has been apparently removed in its entirety, and treats the patient with a as they would have a dry socket. And maybe patient keeps going back, and keeps being treated as a dry socket. Eventually the patient might get fed up, go somewhere else, someone else takes an x-ray, and there's half the root left in there. And unfortunately, whilst the person who carried out the extraction will be criticized and vulnerable, so would the second person for not taking a closer look and establishing, because if the patient's in charge in front of you, you're in charge of the care. You can't say, well, the note said. It is your patient and you're in charge of that patient's care. Now, one of the areas that we do see people face significant challenge is if there's a perception of misleading a patient, or at worst being dishonest, a perception of being dishonest. So a situation like this, unfortunately, they do occur. Files do fracture. And the worst thing you can possibly do is just pretend it hasn't happened, fill it up and move on. Because the chances are that a tooth has been root filled may well, as the patient, before the patient passes away, be x-rayed again. And if it is, then that patient is going to be told there's a file in there. So it really should be something you have to sit the patient up and explain, because if that patient was to establish some point in the future they've got a problem and it's associated with a file that maybe you broke many years ago and didn't tell them, or even just recently, then it won't be the fact that the file broke that's the problem, it's the fact they weren't told, and they will come gunning for you. So please bear that in mind. These things do happen, you know, and it's something we can act appropriately and facilitate and sort out, but the patient must be known. Knowing where to stop. I've mentioned competency a couple of times. Obviously, here's a rather dramatic example, but we have to be aware of what we can tackle ourselves, what we should tackle ourselves, and what we would pass on. Now, some things do happen, and again, a bit like the fractured file, it's very important that we establish communication with the patient when this has happened. And we've seen cases where people have had sinus complaints for several years, only to find out subsequently after further investigation that it was a root pushed up there. And again, just like the file, they'll then go for the clinician who should have known or didn't tell me and that can end up with a dental council complaint because it's a challenge to the individual as well as a claim. Sometimes we miss things. If you have a quick look at that x-ray, I'll come back to it. Quick look at the x-ray, what you're going to do? Well, what we see there is, perhaps most of us had a quick look at the first molar, and there was a filling placed, and the patient came back. Now, I won't pass comment on the filling, other than I don't think it would get full marks on your clinics if your tutors were seeing that one. Bit of a ledge. And if we look in this situation, the patient's come back in continued pain, and when the second dentist takes a periapical, then you can see, unfortunately, that it's actually the 8 that is grossly carious, and that's where the pain is coming from. Now, in this situation, what had happened is the first dentist had done the filling, then they had gone on holiday. Patient came back and saw dentist number 2, who took this x-ray, and dentist number 2 said, well, we're going to have to take out the upper wisdom tooth. The upper wisdom tooth was extracted, but unfortunately, the tuberosity, the bone surrounding that tooth, which is sometimes vulnerable, clicked and came out. Now, because the tooth was unfortunately extracted with the bone, which can happen, patient obviously not very happy, but what was the word I used before? Predisposed. Patient's not happy because of his experience with dentist 1, and now this has happened on top. A big complaint occurred. Okay. Now, in isolation, if the tuberosity had fractured just with dentist 2 and the filling wasn't there, there might have been an explanation, a discussion, and it hadn't escalated. But you add the 2 together, and dentist number 2 unfortunately fell foul of a predisposed patient who was predisposed by dentist number 1. Patient's expectations, really, really important. If you are saying to a patient, in this situation here, we've got an upper edentulous ridge, but flabby ridge because it's been biting against lower teeth for years, all the bones are absorbed. And when the patient says, I want a denture that doesn't move, well, it's not possible because it's the platform upon which the denture is going to be placed is moving itself. So you need to have discussions clearly with patients beforehand, because any explanation after the treatment's completed is considered an excuse. Okay, so it's important that we establish patients' expectations. Now, some patients have very, very high expectations, and sometimes we see patients with body dysmorphic disorder, which is quite rare, but it's basically someone who becomes so incredibly self-obsessed with their appearance that they may go around, and part of that, as well as Botox and fillers, etc., is cosmetic surgery and having smile makeovers. And if you see patients who are disproportionately raising concerns about a tiny little mesial incisor ledge or a tiny fraction of a midline, just ask yourself, is this someone I need to be treating? Because you may enter into a cycle where they're saying, no, I want it done again, and knowing when to stop. And I often say it's like when you're making when you're doing treatment, can you see yourself a benefit of having another go? Can you see an improvement? And often that's described when you do full dentures. If you say, I'll make you another set, only do so if you can see some benefit doing that, not just having another go. Another area people get into difficulty is when the patient pushes them into doing something. Here's an extreme example, because that just is not going to be possible to endodontically treat and restore those teeth in any wish or way. But the patient has forced this dentist who's given in, said, okay, I'll have a go. Now, the problem is the very nature of the people who push and won't listen to reason or won't listen to expert advice are the ones who will turn around and bite later if there is, and when there is, for example, in this situation, a problem. So unfortunately, it's worth having to stand up to the patient in the first place and say, look, you might find someone to do this root canal treatment. It's not going to work. I'm here to help you, not harm you. So I'm afraid I'm not the dentist for you to do this. So if a few colleagues had said those words at the beginning of a situation, they might not have ended up on a journey of regret later, having taken the patient on. Over the long term, considering long-term awareness with a patient. Now, in some countries, we are seeing an increase in the number of periodontal claims where a patient is saying they've had no long-term assessment and care, and the perio's just got worse and they've lost bone gradually over years. They've gone to another dentist, either they've moved or change practices, and suddenly the new dentist says, wow, you've got chronic periodontitis and your teeth are all mobile, you're going to lose them. Well, naturally, they can be quite disgruntled. Now, I'm just looks as if my sharing screen has stopped, so I'll just go back and reshare. Not quite sure what happened there. Can somebody confirm that the
Yes,
presentation is back?
Is in view again, James?
Sorry?
Yes, we can see your screen.
Okay, I don't know why it dropped off, but it's there now. That's good. So the presentation is up, yeah? Okay, so I'll carry on. So the long-term care, we need to be aware of the situation. If you're going into a practice and you're taking over a patient who's been at the practice for many years and you see something like this occurring, you need to be seeing the patient yourself based on your own findings, not of anyone else in the practice. Okay. Now, another reference to competence, little concerning this situation. If you have a look at this X-ray, this patient has a significant orthodontic issue, significant skeletal situation going on here. Now, this was taken from an online dental forum. This patient has been advised he would need surgery, but doesn't want this. He would like a brace for his top teeth. I would welcome any advice how to carry out orthodontic treatment. Now, this is from a young practitioner in another country who is basically saying, how do I treat this patient? Well, this is one of the most difficult situations to challenge and to treat. And the patients obviously had received advice, and, or in this case, had received advice from others about the extensive treatment, which included orthognathic surgery, yet they're going out onto the internet saying, how am I going to treat this? So this is a worry, and perhaps something I hope we would not see much of, asking how to treat that way. What are the current dental legal hot topics? Okay, so we'll just touch on these. We see issues with implants, we see issues with short-term orthodontics, we see injuries following extraction of wisdom teeth, and problems with smile makeovers. Those are the sort of 4 big ticket items at the moment that we see across Asia. Now, in terms of implant treatment, we see problems where implants impinge on the nerves. Now, we see in the 4th quadrant here, we have an implant that is too long and it's been placed such that it's perforated the inferior dental canal and impinged on the inferior dental nerve. Now, unfortunately, this does happen. People talk about a 24-hour window to reverse the implant and decompress the nerve as giving it the best chance to recover. But unfortunately, these injuries can be very significant, and you can get a neuropraxia with it, which is like a debilitating shooting pain as well as the numbness, which is, you know, sounds a little strange, but that can be debilitating and make people struggle with in themselves, and depression can occur, and it's a very awful situation. So these do occur with implants and are significant cases. And it's all about pre-assessment and planning, stents, depths, etc. And because it can all be avoided. Wisdom teeth, unfortunately, we do see injuries, usually crush injuries with the removal of wisdom teeth, and also lingual nerve injuries when in the distal-legal region, and they can be just as disturbing as the injury with implants. I know in Singapore, the prophylactic removal of wisdom teeth is present. I have a very different practice in the UK, where under government guidance, there's certain episodes of pericoronitis or certain situations would have to be present before we're recommended to remove them. There's arguments both ways, but certainly when assessing the removal of the wisdom tooth itself, that's critical and an area where, you know, further training is sought by many colleagues before they feel competent to tackle those. Here's an example, and we do see sometimes people engaging on this, but significant risks. And I think when we're looking at these, and most treatments that are complex, we have to ask first of all, is this something I should be referring on, or perhaps even doing with a mentor? Not in this case. And I think the first question is, would others expect me to be able to do this myself or to refer on? And I think importantly as well for patients, they need to be given the options, which may include specialist referral. So in terms of short-term orthodontics, consent and aligner treatment, consent's often the case issue here, whereby a lack of retention or resultant open bite from straight six or midline issues, they're not warned of or established beforehand, resulting with unmet expectations. And if there's a vulnerability with the treatment or consent, then upon reviewing the case, it's often best to get the situation sorted by getting remedial orthodontic treatment costs covered. And that's something that we do quite often. And in terms of the approach recommended, if there is a problem, engage with the patient, get with them on that journey. Proactive case management through early intervention is what we like, and support colleagues with. Proactive approach. If there's a problem, waiting for the claim or a dental council case to arise is certainly not helpful. Shutting the patient out, pushing them away, challenging them, that'll start a journey that one would always regret. A litigation process is adversarial. It's not present. It's rare. Let me please say, emphasize the point again, it's rare. But if a problem occurs, you need to look after your patient. And groups like us, we're here to help and can help you on that journey to reduce the risk, but certainly not shutting the patient out if things occur. And here's an example where there was an awful injury. So forgive me for the imagery here. It's not very pleasant on a Friday night for you, but here we go. We've got a endodontic lesion, working length X-ray. That's the lesion, considerable lesion, and sodium hypochlorite was used to irrigate. Unfortunately, sodium hypochlorite with a non-side venting needle and pushed way through the apex, which resulted in necrosis, a significant and very unfortunate and very painful episode that resulted in having to lose those teeth and have the bone removed, what was left. Now, you'd immediately think of that situation leading to the most significant claim, dental council. But what had happened in this case is that the dentist went on the patient with the journey, went to some of the appointments with them and stuck with them all the way and covered the cost of the treatment. And there was some compensation that was provided by ourselves, but there was no legal fees, there was no formal problem, and there was no dental council referral. And that was a testament to the support and to the individual himself keeping on with the patient. Yes, it has to be the right patient that's going to go with you, but that had all of the potential to be a very nasty in a very nasty situation. And the patient did say at the end of this case, I appreciate, that I'm not happy about the event and this, significant loss to me, but you've always looked after me and you've expressed regret and you've kindly looked after me. And that was the sort of approach that we need to bear in mind. There are some cases where that's not perhaps going to be so easy, and some cases where the responsibility of our care, we have to question the approach we've taken. And we see, for example, this case. Here's a lady who attended and said, look, I've got a problem with my midline. I just want that sorted out. And they were persuaded, lo and behold, to then from that go to a full mouth of crowns. And unfortunately, 12 months later, that was the scenario. So to turn that, an issue over the aesthetics could have been easily amended, and very healthy virgin dentition, very healthy dentition, to result in that. The size of that claim was absolutely enormous, and the dentist was in significant issues with the regulator. So we need to be careful. We've got the drill in our hands, but it doesn't mean we're entitled to use it. We've got to get the right cases. Now, dental regulators, I mentioned And if you, again, you look at the rules of the game with the ethical codes. I mentioned this area here where they've got an x-ray of a nice dentist's neck. You've got to look after yourself. You've got to look after yourself, because if you are struggling, musculoskeletal, if you're in pain or you're having bad back, sometimes your empathy goes and you may be more vulnerable. And there's a lovely acronym for when you're at risk of dental legal issues arising as a result of you yourself, and it's called HALT. And basically what that is, it's when you're hungry, angry, running late, and you're tired, you're more likely to be in a risky situation. Okay, so if you think about that, if you're working a late night, you haven't eaten, you're running late, you're shattered, you know, should you be plowing on with the work, maybe a complex work? Might you want to amend it that you're doing simple stuff at that time of day? Worth thinking about. Remember, hungry, angry, late, and tired. You shouldn't be operating on certainly complex, or should you be operating then? So to bring to a close, in terms of your reputation and your future, I know it'll all seem a bit distant, some of this to you, because it's in practice, but it's the concepts that I would like to get across. You know, you're successful, you're achieving, you've got a great profession in front of you, but just remember these things: a professional approach in all things at all times, effective communications between yourself, your teams, other dentists, and of course your patients and their families when appropriate. Avoid fight or flight. If a patient is aggressive and offensive, that doesn't mean we've got the right to be aggressive and offensive back. Of course, you defend yourself in offensive terminology, but what I mean by that is, if a patient is wagging finger, screaming, shouting, don't return the favor, because it'll explode. And properly document. If you are keeping good records, you're in a much better situation than people who don't, should there be a challenge, because that's where the Dental Council will look at your records, and that's where lawyers look at your records. And if things are down there, you're in a much better situation. And avoid predisposing your patients. Build a rapport, build a relationship with your patient. And then if things go wrong, because unfortunately we're human, then they're far less likely to challenge you if they consider that you are someone who cares for them. Demonstrate that. Now, problems will occur that you can't avoid, but you can influence the consequences. And I hope there's been a few little tips there to help you with that. Last slide is, well, who cares for the carer? Look after yourselves. Now, at the minute, you've probably got very mobile, easily moving backs. If you look at a few older dentists like me, we've got crooked necks and backs, and it's sometimes physically difficult to do treatment. So you need to be looking after your backs for the longer run. You've only got one spine. And I would say the career in dentistry is you've got years ahead of you. It's a marathon, not a sprint. So don't burn yourself out in the first few years by working 7 days, 16 hours a day. We do see it happening, but I would take a longer view. That's just my personal view. I think it is a long game. Looking after your finances, dealing with stress, work-life balance, it's all important that every now and again you just assess yourself. It can be a stressful job. It can be hugely rewarding, but there's some of us at some point will all have areas where times that it's a bit stressful, and you just make sure you look after yourself. I think, as I say, you are at a point about to embark upon your career. There's a huge amount to be said for the joys of doing the job. Unfortunately, when I deal with colleagues, sometimes it's a time when there's been a complaint or a problem, but it's a real privilege to look after somebody in those situations. They are rare, and I hope that you never have to have a situation like that, but by establishing patterns of behavior, etc., that we're talking about here, and I would refer you to our websites, etc., you can help avoid these in the first instance. And I shall stop there and pass back to Julia.
Thanks, James. Hi, everyone. My name is Julia, and I'm the local contact for you. I'm just going to share my screen really quickly. Just give me a minute. Can everyone see my screen?
Yeah.
Perfect.
It's gone to notes. You need to project. Go to, I think you're on notes, so you need to be projecting.
I am, okay, give me a minute. Better?
No, that's it. That's it.
All right.
No, it's gone back again.
Oh dear. Just give me a minute, everyone.
That's it. No, if you go to presenter view, I think it takes it off this screen. No, it's taking it off.
Oh dear. Okay, you know what? Let me just hold on. Is this better?
Yeah, that's good.
Okay. So tonight, actually, I wanted to start with the itinerary. James have actually given us his presentation on how to avoid medical pitfalls. So for myself, I'll actually be doing a presentation on the MPS or the DPL student membership. And then that'll be followed by a Q&A. And then, of course, we hope to end the event by 8:45. Throughout the presentation today, you will see that I will actually be flashing the QR code. So the QS, the link that was sent over. So currently, if you were to actually sign on as a student, we will be giving out capital N more vouchers to all the student members. So I'm going to start my presentation by talking a little bit about MPS and DPL. So MPS and DPL is actually the largest medical legal organization in the world with 30,000 members. So we are a not-for-profit organization. What this means is that it's for members. So our organization employs doctors and dentists such as James Foster. So for DPL and MPS, our purpose is to protect the careers and reputation of doctors as well as dentists. So just to share with you, for MPS and DPL, so our members, we are actually located all over the world. So this includes the protection and the type of protection that you will need. So once you have actually qualified yourself as a dentist, you will need to know who the indemnity providers are out there. So James actually gave us a short presentation just now in terms of selecting your provider of professional protection. So when you are going to actually select your indemnity or insurance provider, once you have graduated, you will need to ask yourself a few questions in terms of what are the support that you expect from the insurance or the indemnity provider. Take a look at the cost that they offer. If it's very low, you need to ask yourself, are there limitations as well as are there terms and conditions that you need to take care of? When selecting your provider, you will also need to ask yourself, do they actually have got a team of experienced medical legal or dental legal assistants? As I said, we are a dentist for dentists and doctor for doctor organization. When selecting your indemnifier or an insurance provider, you need to see what are the provisions of protection there are for retirement. And the most important, do they provide a long-term relationship with you? DPL and MPS have been in Singapore for the last 50 years. So for our student membership, currently now it is free for all. So it is complimentary. So as a student member, your benefits include you actually get protection. So which means, of course, for now, during COVID, you might not have the electives. However, once, we have actually moved from COVID and you actually have got your electives, we do actually cover you. So there is elective protection. And at 24/7, if you need help and advice, we do have a helpline for medical legal as well as a dental legal advisor. So our medical legal, as well as our dental legal advisors, they are doctors, dentists, and medical professionals. As a student member, you will be eligible to attend medical legal talks or dental legal talks like today. So we also give you a whole plethora of resources for our student membership. This includes casebook and resources, as well as you get access onto our online learning platform, which is called Prism. So the question is, how do you join? So currently for today, I'm now going to flash to you the short QR code. So if you're interested, I'm just going to leave it at this screen so you can actually use this QR code and log in. It only takes, I've tried it in the system myself, it only takes about 2 minutes for you to actually enroll as a student. And if you do need further support and information, there are actually, we do actually provide publications, booklets, fact sheets, and case studies on our dental protection page. And this is my email address if you've got any other questions. So for now, because in the essence of time, I'm going to pass it back to James. And we are also quite proud that we actually have got Dr. Lim Lee to join us tonight for our Q&A session. James and Dr. Lim Lee, please.
Thank you. Thank you very much. And Dr. Lim Lee, thank you ever so much for joining us. I know it's late notice. I'm very grateful to you joining. We've actually got a question, Lim Lee, that's come in. Perhaps we could tackle that as well. And it's saying about how is it actually possible for us to reject treating patients? Will there be any consequences for doing this? And I think, I don't know about your views, but I think if a patient's got an emergency and they turn up to your surgery, then it's very difficult to turn them away. But if you've got someone who hasn't yet started a course of treatment, and it's particularly an elective course of treatment, you're perfectly entitled to say, I'm not your man or woman.
Absolutely, James. Yes, in terms of emergency, we are not supposed to turn away any patients. We're supposed to give due care. But if you're seeing the patients for any other treatment, it's always okay to say that, I mean, for me personally, what I will say is, your treatment requires this and that. I give you some opinions, and I think that you may be better suited to see someone else. I think just phrasing it in a nice way, just gives them the idea that they should go somewhere else. I mean, there are many times that actually I turn away patients because I feel that I will not be able to meet their expectations. Not because I'm not competent to do the work, but I think that maybe our temperaments do not align, that sort of thing. So it's important. Case selection is very important.
I think there's colleagues who've seen a patient and they've been excited by the treatment plan. They thought, oh, yeah, I'll get that, and not considered the patient behind the teeth. Because if that patient is someone who jars with you, you don't get on, or you think there's a problem in terms of expectation, there's lots of people that say, I wish I'd listened to my gut feeling when I first saw them. And the reason I know that is because they tell me that a year or two after there's been a horrible journey that's gone wrong. So I wish I'd listened to my gut feeling. And I think we have a lovely innate gut feeling about people when we meet them. And if it's somebody who sets you that you think maybe no, then it's far better to be strong at the beginning and say, I'm afraid I'm not the dentist for you. There's others who will do it, but I'm not the dentist for you, if you feel that way. Yeah.
And I think another point to note is sometimes when you first meet a patient, you may not know the true colors of that patient, especially if just the first meeting or two. And I said, I think it's important before you embark on any more challenging treatment plans, other than this routine scaling and polishing. Perhaps if they're going for a full mouth rehabilitation or implant placements, I think it is better to tread cautiously to find out more and understand the patient more before not so-called jumping into implant placement on the very first visit.
Yes,
I think,
Yeah, get to know your patient before you embark on that big journey, particularly a longer treatment plan. Yeah. Yeah,
Yeah, that's
absolutely.
right. Yeah.
And then for the younger, our younger colleagues, they're in a situation where they've obviously achieved an awful lot. They're about to go into practice. When I say it's a marathon, not a sprint, would you agree? Do you see burnout from colleagues who have really pushed it in the first few years?
Yes, definitely. I think we are looking at, say, practicing for at least 30 years, I think, So I think pacing yourself, and also if you're doing a sprint in the first few years, mistakes, human errors tend to be more because, as you said, tiredness, etc., running late, all these things come into play. So I think pace yourselves, and I think my advice for graduating dentists or dentists coming into practice is work within your comfort zone.
Yeah.
Don't push yourself too much in terms of your speed or your competency. It will come with further training and doing more work. But I think that we just have to be very careful not to not to push ourselves to do all the treatment that we see the patient needing, especially as you said, like for yourself, you didn't really complete a molar endo, and then maybe the first 2 days of your practice, you have to do a molar endo. I mean, perhaps, these are things that we should consider. Maybe we should refer the endo out. Yep. And then go for more courses.
And go do a course. Absolutely.
Yes,
yeah.
That's
Recognize.
Right. That's right.
I think it's recognizing training needs as against training wants.
That's absolutely. And I think that we should not be pushed into doing things that we may not be comfortable with. I do see, because I sit on the complaints committee, I've done quite a few mediation cases with the Dental Association. I've seen our young colleagues fall into this pitfall that they feel pressured to do the treatment. They are working in a clinic and the patient comes in, patient needs molar endos, which probably they have not done a lot, and they feel very pressured to carry out the treatment, although they may not be very good at it, because perhaps it's a matter of pride, or they feel pressured by their principal dentist to fulfill a certain number of cases, etc. So I think it's important to know what you're good at, and then perhaps work within what you're comfortable with. Do not be pressured by either dentist or the patient, saying, I don't want to go somewhere else, I want to see you. Just be frank. You just say that maybe, I'm not very suitable for this procedure. Yeah. There's nothing to be ashamed of, I feel. It's nothing to be ashamed of.
Yeah, I think because we like to dive in and say, yeah, we can, there's a challenge, we can do it. I think one of the other things as well is being in charge of your appointment book. Because if you are, say, when you start in practice, if someone else is in charge of your timings and certain parts of the day, it can be very difficult. So I think run your own appointment book, make sure you're comfortable seeing people when you want. I think I did talk over a bit longer than I intended, as usual. So Julia, I think we've perhaps come towards the end of the timing, is that correct? And I just think, Lim Lee, I've had the pleasure of working with you on several occasions, Lim Lee. Thank you so much for being part of this tonight. And
you're most welcome.
It's very kind of you to hop on. And I understand you now do some teaching at the hospital.
Yes, I do. So any of the students who want to come and look for me, I'm doing that. I'm taking the first years at the moment.
Yeah.
So, but I'd be happy to help anyone or speak to anyone who needs anything at all. Yeah.
Well, the school is a richer place having your activity with them now. Absolutely. And
Thank
I'm
you,
sure
James.
the students will benefit hugely from your experience. Thank you, for listening, everyone. And Julia, back to you.
Thank you so much, James. I want to thank Teng Chun as well as Dr. Lim Lee for your time tonight. I also want to thank everyone. So again, I'm flashing the QR code. If you're interested to win the CapitaLand vouchers, please do enroll on our complimentary student membership. So this promo will end on Saturday, 11:59 p.m. So the results will be out. So Teng Chun and the rest of the Exco team will have the names of the winners. And of course, I've got your email and contact numbers. I will be contacting the winners. If you have any questions or feedback on our webinar tonight, please do get in touch with me. So my name is Julia on behalf of DPL. Thank you so much for your time, and we'll see you again. Good night.